Welcome everybody, and thank you for joining us for the new Hillingdon Hospital Roadshow. Very conscious everybody's busy, so a huge thank you for joining us tonight. We've got approximately an hour, and what we'd like to do is give you a short update presentation, and then following the presentation have some questions and answers. So presenting to you tonight will be myself. So my name is Jason Sees, and I'm what's called the Senior Responsible Officer for the redevelopment programme, which is a sort of posh way of saying I'm the person who's leading it. We have Tahir Ahmed, who's our Director of Estates and Facilities. And see merrily waving there, and he is seconded full-time to the programme and is leading on all the estate works. Vicky Cook is one of our hospital consultants, and she's also one of our clinical leads for the redevelopment, and she'll be presenting some of the clinical side for us tonight. And then you heard Neil at the beginning. Neil is one of our communication leads for the redevelopment programme as well. So that's what we'll be doing. I'll be presenting, handing over to Tahir. Tahir will hand over to Vicky. It's turning into like one of those baton races, I know. Vicky will hand over to Neil, and then we'll do Q&A at the end. So to get us going, if we can move on to the next slide, please. So as we've just sort of been going through the plan for this evening, just a brief part of where we are in the process, what we've been working on, how we've improved the design, piece on how better design will improve care for our patients, how to get involved and ask questions, and then we'll have a question and answer session at the end. So if we just move on. So this is the dry slide, so I'll apologise in advance for those that have seen this before, and I've had to go through this with you, but it is an important slide. So I just want to go through these sort of headlines in terms of the process of how do you build a new hospital, and I want to start on the left, and then I'll take us across to the right-hand side of the pictorial that you've got up there. So if we just start on the left-hand side, there's something referenced there called the Health Infrastructure Plan. And that was a publication by the government in late 2019 that sort of really highlighted that for England, one of the national sort of flagship programmes was the building of 40 new hospitals. And as part of that announcement, Hillingdon was one of the named new.
There's something in the open. Just keep an eye on it. I've got a meeting till 7 o'clock. Oh, Amari, I'm sorry.
Yeah, all right. And I know it's a bad slide, but I don't. Children crying. This is a first for me. Thank you. So that's the piece just on the health infrastructure plan. We then updated our clinical services strategy, so very much sort of outlining sort of what our key services are and how we want to take them forward. And that was in 2020. And then the three next boxes refer to the strategic outline case, the outline business case, and the full business case. The way hospitals are now funded, so previously for the last couple of decades, new hospitals were funded through private finance initiatives, where in essence a private contractor and a private consortium built your hospital for you, and then you in effect paid it back on a mortgage sort of basis over, say, 30 years. For the next generation of hospitals that are named in the health infrastructure plan, they are going to be paid through something called public dividend capital, which in effect is the money from the Treasury. The Treasury have something called a green book, and that green book is very detailed in an approvals process. So the strategic outline case is the first stage, and that pretty much outlines what you want to do. And we had that approved in 2020. The outline business case is then going into a next level of detail, and that very much focuses on how we're going to do it. And we are currently in the process of finalising our outline business case at the moment. And then the next business case after that is something called the full business case. And that focuses more on who you're going to do it with. So in effect, when you've got a builder on board, going through at a very granular level, how you're going to build it. And once you've got that completed, the main construction commences. If we just move on to the next one then, Neil. So in terms of what we've been working on, I mean, it's a fantastic achievement by all our staff, very much working in sort of partnership on a number of levels, that the strategic outline case was approved on our sort of first for the centre, and it has really been driven on many levels, sort of a trust level, our clinicians leading the process. We've also been working in partnership at a local level with all the local stakeholders, so the GPs, community and mental health services, the local authority, the voluntary sector. So a huge amount of joint working there. Similarly, at a regional level, there's something called integrated care systems. So all the sort of providers in Northwest London very much supportive and are formally on record of approving our plans. And then at a London level, NHS London have been sort of very supportive. And we're also working in partnership with an organisation called the New Hospitals Programme, who we're sort of taking forward the development of our plans. What we're now sort of doing after that strategic outline case is going to that next level of design. So we've done the 1 to 500s. We're now working on the 1 to 200. So the next scale down of our designs, looking again to get as much feedback as we can through public engagement and working with all our local stakeholders. The piece I just mentioned earlier, just on the New Hospitals programme, there are, out of those 40 schemes named in the Health Infrastructure Plan, 8 are sort of referred to as pathfinders, which are the schemes that are almost sort of leading the way. And it's again, with everything that's been going on with COVID and the sort of phenomenal work all our staff have been doing, they've also been pushing forward the plans for our redevelopment to such a high quality that we're really now positioned ourselves at the front of the pack. So that is in essence my piece at the beginning, and I'll hand over to here now.
Thank you, Jason, and good evening to everyone. I'm just going to apologise in advance because I seem to be having intermittent network problems. So if I do, I'm going to just switch off my camera. You should hopefully be able to continue to hear me and see the slides, but I'll see how far I get. But thank you again, Jason, for handing over. I thought it'd be quite helpful, actually, just to put a slide up to orientate you in terms of the Hillingdon Hospital site. Some of you will be familiar with it. We've shown it here, dotted in yellow line in terms of the site, with Peeled Heath Road to the north, and that's where you have the main entrances coming into the car park, and to the west, Royal Lane, to the east, obviously, Colham Green Road, as earmarked here. What we've also shown, just sort of greyed out on this site, is to the west, where we've indicated where the new hospital will be. We are already into a very extensive decanting enabling programme where we're actively working towards moving what is some of our most dilapidated estate really into temporary but fit for purpose accommodation nonetheless across the estate, so that we can have a cleared site in readiness for when we then start the new hospital build. If I may have the next slide, please. Thank you. This then is in response to where we would eventually end up, and that's our new hospital. So again, just to orientate you, number one, marked on the plan here, is where the new hospital, the clinical building as it is, will be sited, and just north of that will be a multi-storey car park, a new mobility hub, which will include lots of things from EV charging, cycle parking, patient discharge, etc., from patient transport vehicles, and a link across, which is not quite evident here, but I have got a slide just to give you that in a little bit more a visual presentation. What's also important to note here is the amount of green space that we've created as part of the new hospital, and that's something Jason mentioned COVID. These are all lessons learned and the feedback we've had around having not just space and good environment within the hospital, but also how the hospital sits and nestles really within its streetscape as well as within its surroundings as well. So point number 3, the triangle bit in the middle is a new green open space. To give you some perspective, that's about the size of Leicester Square. So this is a pretty good, impressive space. To the south of that, we've got further ground floor car parking, and again further south, some very nice wetlands area, and then complemented with the opportunity for some residential, but also more importantly, the retained estate of the hospital. We have some listed buildings known as the FIRS, etc., which we'll continue to use as part of the administrative functions of the hospital. If I could move on, please. Thank you. This is just really a look back from that green space. It's not all of the green space. It's taken from an architect's impression of what the new hospital will look like and give you a perspective of openness. Thank you. Have a look at the next slide. So what have we been doing through the summer? Well, we've been really busy, actually. We've had lots of engagement with both patients and the public, and that has helped us shape where we are in terms of the number of iterations we've made to the hospital design. In parallel with that, and Vicky may touch on this in more detail, is we've had engagement with not just our clinical colleagues, but the operational teams as well. In responding to their requirements for what the facility will provide. In parallel with all of these work streams, we've had extensive engagement through a planning performance agreement with the London Borough of Hillingdon, the planning authority, and we believe that all of their queries have now been answered. And again, as Jason mentioned, as part of the new hospitals programme team, they've had active dialogue with us in relation to how we would respond to meeting some of the evolving requirements of a new modern fit for purpose state-of-the-art hospital as well. All, of course, neatly wrapped up within a clearly defined cost envelope, and that's where we've been doing in terms of the extensive work this summer. Could I have a move on to the next slide? We might move quite rapidly actually as well. I thought it would be again helpful just to give you some illustrations, some graphic sort of architect's impressions of what the hospital might look like. And what you can see here is where we've used new modern methods of construction. And what that is ensuring that we can not only build a hospital, but build it at pace or fast track delivery, but also ensuring that there is good, high quality building structures, buildings that are actually meant to last, buildings that will look good from day 1 and year 60 further down the line. So we've done a lot of work around this agenda. And what this is an image of is, if we could just go back a little bit. The image here that you see is, thank you. The image that you see here is from Royal Lane, and this is the separation between the main hospital and the multi-storey car park, which provides really good green open space, but also good permeability access through into the site as well. So you don't have to walk all the way around. There's good access points and spaces to access the hospital more conveniently. Thank you, Neil. Again, just another perspective. These are work in progress at the moment, but again, it shows the link across from the multi-storey car park back through into the hospital at different levels, which also provides good access to those services on the upper levels of the hospital. Thank you. If I could move on again. And just to finish off then, before I hand over to Vicky, one of the other big agendas that we have in plan for the hospital is to ensure that we're delivering a hospital in line with the government net zero carbon specification. So we'll be using a multitude of tools and approaches to building techniques that not only bring together the modern methods of construction, but also ensure that this is a fully sustainable hospital for the future. Thank you. I'll hand over to Vicky.
Thank you, Tahir. So I just wanted to bring in the clinical aspects of this new hospital. And I think what's really important is that we started with designing how we wanted to provide our services and how we could do better in providing services to our patients. And then we've worked as clinicians with the health planners and the architects to start designing a hospital that actually works for us for what we want to provide rather than a random set of buildings. And this has meant that we are really now planning a hospital that is going to be fit for providing care in Hillingdon going forwards. It starts with emergency care. There's obviously an awful lot of emergency care provided currently, and we have in this new building a huge emergency care and urgent care service on the ground floor with everything co-located. So our short stay beds are emergency, what we think of A&E, but also our support services like our surgical assessment unit, our gynae assessment unit, our medical assessment unit are all co-located in one place. And they have designed so that there's easy access for patients and easy access to diagnostics that those patients will need as well. So a huge urgent and emergency care on the ground floor. We've designed our midwifery unit, so our maternity unit. So again, that's all on one floor. So rather than our current maternity unit where patients are going in and out of lifts, everything is co-located. So our midwifery-led unit is co-located to labour ward, as is the neonatal unit, and our antenatal, postnatal, and wards and antenatal clinic are again all co-located. So that's going to be easy for patients to move from one part of the service to another, and for the staff looking after them to all be in the right place. We have a much larger critical care unit that's going to be fit for purpose, and that's co-located to our high dependency unit. So again, those patients that are in the need of the greatest intensity of care are all going to be in a similar place, so that there's crossover of carers and health providers such as doctors and nurses as necessary. We've been very involved with designing our outpatients so that, again, we provide the right care for those patients that need to come to Hillingdon. There's an acceptance that a lot of the care will be done virtually compared to what we do now, but those that do need to come in and see us on the hospital site will be able to have all the care that they need in one place rather than having to be dispatched around the site as they are currently. So we'll have much better integrated care, and we'll have multifunction treatment rooms so that really we'll be concentrating on those patients that need one-stop clinics will be able to come in and have that care in one place. Radiology is on the same floor as outpatients, so again, much greater ease of use for the services, and throughout the whole hospital, the digital agenda is massive, and really using the best possible digital available to help with the care that we need and to streamline things to make it much easier for the patients that are coming through our services. If I could have the next slide, please. In order to make the most efficient use of this lovely new building, we're going to increase the working hours for our elective services from the current 40 hours to 48 hours a week. And this will mean that there will be services available at different times of day, and potentially at the weekends as well for those patients that need it. The floor space of the hospital, although as you can see from Tahir's plans that actually we're using a lot less of the site for the building, the actual floor space of the hospital will be 40% bigger. So we'll be going up from about 55,000 square metres to 75,000 square metres. And this is mostly because the space that we provide will be fit for purpose rather than our small cramped facilities that we have at the moment. But our bed numbers are going up slightly to 400, from 484 to 489. Now, although one might be thinking that with the care needs, the older population, more complicated care needs as we go further, that we might need more beds than that. But actually, because the way we're providing care is very different, and it'd be very much about providing care in the right place rather than bringing all our patients into hospital, we've done a lot of work with the health planners and are confident that the actual number of the hospital beds doesn't need to increase significantly. However, those beds that we'll have will be much greater numbers of single rooms. At the moment, we have a very small number of single rooms, but the plan is that overall we'll have 70% single rooms. That will vary slightly from service to service, and we will have, having learned from the pandemic in the last couple of years, we'll have one full isolation suite with proper air changes that are required for such things per 8 beds. And critical care will be split into 2 clusters with 4 bed bays and 6 singles, so 10 on each side. So again, it will be much easier to split into different flows of patients as needed for pandemic and future problems with pandemics that may come through. So a very, very different building to what we've got at the moment, but very clinically planned. And I just want to say what great engagement we've had with our clinicians. So we have doctors, nurses, allied health professionals such as physiotherapists all working together so that everybody has a voice to make sure that we are planning the right accommodation for the services that we want to look after our patients in the future.
Thanks for that. I just thought I'd just finish off with just some quick information about how to get involved. So obviously there is the website which allows you to look through the plans, which is the first link. Please also do sign up to the newsletter, which is again on our website but on a separate page. There's also opportunities for us as a question if you follow that link. And then we're always doing things, and I think this is the key point, is that we always want to have a kind of ongoing conversation with people. So, for example, at the moment, we happen to be doing a radiology survey. So if you go to the radiology department, you'll probably see some of the invites to do the survey. So if you've ever kind of gone for a scan or anything like that, please do fill it in. There's also lots of opportunities around the hospital, which is what some of these graphics, I hope, and increasingly around the hospital, which we'll have some more of these graphics popping up. And so those, I suppose, are some of the kind of the passive things you can get involved, but also, you know, we were talking about some of the engagement we're doing, but we also want to hear from more groups of people. So we're also targeting different groups of people with focus groups. So we had a maternity meeting last week. We did some meetings with carers before Christmas. We're doing some more of those as well. So hopefully might see you out and about as well. So if I just hand over to Jason, maybe to start off the Q&A, if that's all right. Oops.
Thank you, everybody. So hopefully that's just given you a whistle-stop tour through of the sort of key headlines. In terms of, hopefully we've all become sort of team savvy-ish. I'm still probably learning. If anybody's got a question, if they'd like to raise their hand, and I apologise in advance if I get people in the wrong order that they actually put their hands up. But I think Tony's been swift out the blocks already, so I can actually sort of follow that one. But do please shout if I do miss anybody. But as it stands, I've got Tony, then David.
Thank you, Jason. 2 questions. One of the problems we have now is bed blocking. How confident are we that the community is going to be able to step up to the mark to actually provide beds for the people at the present block our beds because there is no facility for them to leave? And my second question is, I'm sorry I'm greedy, my second question is, what on-site facilities do we have for the staff to go to, like shops and cafes?
Thank you, Tony. So I'll start with the first piece, if that's okay, and I'll let Tahir think about the sort of big sort of Westfield shopping centre he's got in his mind. But just to start on your question around bed blockers, absolutely critical question, Tony. So there is an element in how we've approached this of absolutely making sure that we're not planning in isolation. So our new hospital will very much be part of a local health system that we sort of refer to as Hillingdon Health and Care Partners, which is a partnership of ourselves, CNWL, who are the Community and Mental Health Trust, so your reference to community beds, the GPs, the voluntary sector, Health for All, Health Watch, so all the key partners are sort of around the table. A key part of what we've been doing as part of both the strategic outline case development, and we're now doing in more detail at the outline business case stage, is really working with our partners around what are they doing at a granular level over the next few years as we sort of take forward our plans to make sure that patients are treated in the most appropriate setting. So we're very clear we want to absolutely have a 21st sort of century state-of-the-art hospital that provides fantastic acute care. But we're very much working with our partners for the other parts of the patient journey, whereby people will want sort of different types of care provided for them by our partners, that they have the sort of capacity and all the plans in place going forward to ensure that that has been developed over the next few years as well. Because you're right, Tony, from a patient perspective, if you're medically fit for discharge and this is not a slight on hospitals at all, but when you get to that stage, you do want to leave hospital and you want to go to a more appropriate setting. And so we're currently in the process of reviewing with all our partners a refreshed plan to make sure everybody's clear about what needs to be done to ensure that patients get the best care in the best setting. I don't know if Vicky, if you want to add to anything. If not, I'll hand over to Tahir on the shopping. Is sorry, Vicky.
I was just going to add, Jason, that I think there's two arms to this. There is the first piece about providing the right care in the first instance. So we know that if an older, frailer patient is admitted to hospital, then they lose skills very quickly, and then it becomes much more difficult to get them back to where they were before their admission. So actually, the fact that we're going to have such a large, acute, high, all the right care in the right place in our emergency floor will mean that those patients that don't have to be admitted, who possibly are being admitted now, will never actually be admitted and will be cared for back in their own environment, which is a much safer place for many of those patients. And then obviously the more complex ones will be admitted, and that's where it's then important to have that very joined up working, which we're having to make sure there are right facilities for those patients to be discharged to.
Thank you, Vicky. To hear just about some of the shopping facilities that we will be proposing to sort of incorporate into the final hospital.
Yes, thank you, Jason. And Tony, just to reassure you, we're not going to be building Westfields 2 here. Right? And of course, it's a really important question actually, because we do something what's known as placemaking. This becomes a place of work, but also a place where you should enjoy yourself and be able to sort of get out and enjoy the amenities of the space that we're creating, along with all that very nice green urban factor green space that we're creating. So what we've done is, as part of our discussions with the local authority, we worked within the limits of being able to bring onto the site some active frontage. So the car parking that I showed at the very start, it'll have an active frontage of shops and cafes that will be complementary to our local town centre. We're not going to move equally Uxbridge town centre here onto the site, but actually have more complementary services that will support the hospital and some of the residential facilities that surround the hospital as well. So please be reassured, we will be providing a number of very nice complementary shops, cafes, and equally even a bicycle repair shop has been mentioned as well.
Thank you, Tahir. Tony, does that answer your questions?
Can you reassure me to hear that our staff won't need to go across the road to Tesco's?
Well, I guess that's personal choice, But of course, yeah, no, we'll have facilities equal to Tesco's, both in and outside of the hospital as well.
Thank you, Tony. David.
Yeah, thank you very much. I'm David Bruff. I'm the chair of the Hayes Town Partnership. And I think this is a really exciting project, and I'm really grateful for the update. Can't wait for it to happen. My question really is about digital exclusion. You know, I work very closely in Hayes with a range of different communities, particularly Somali community and the Somaliland community, the Nepalese Gurkhas, and lots of groups. And you know, I find very much that they're getting excluded even more as things speed up. Everything going digital, with benefits going digital, job applications going digital, and certainly the pandemic has really shown up how some families were excluded and children, you know, their education. So really the question is, what sort of consideration are you giving to our diversity, and how we can empower some of our communities who either haven't got access to digital or feel very nervous about it? You know, there's still a lot of people who won't join in Zoom meetings because you know, they're very self-conscious about it, but there are some who just haven't got the computers to start with. So if your state-of-the-art hospital is going to be dependent upon doing a lot more of this sort of stuff for health, how are we going to make sure we don't end up with people being more excluded than they are now?
Thank you, David. I'll start, and then if it's okay, Neil, I'll hand over to you on all the comms and engagement
Yep.
work we're doing. I think it's a really sort of salient question you asked, David, in terms of we're very conscious on reflection that we've done a huge amount of engagement so far, but it's probably, as you say, there's key audiences that are savvy, particularly during the sort of last sort of couple of years, where a lot of the communications has been more through Teams and such like, because we haven't been able to do sort of the traditional piece of more face-to-face and going to see people. So I'm very aware that it's something that we need to sort of really keep focusing on, because as you say, as there is a risk as we become more digitalized, we get used to all talking in this sort of way, but it excludes sort of members of our local community who, again, we need to make sure have an absolute equal voice as we're taking forward our plans. So I'll hand over to Neil, who's sort of thinking through with this at the moment.
Yeah. So thanks, Jason. So that's absolutely right. It is like Jason says, it's something that we're definitely aware of. So in terms of some of the work we're doing, so I mean, I'll give just a brief run through. So for example, so we know that people, so some people are kind of less digitally, we know that some people are just less digitally able. So one of the things we've got, we're going to get some of our discharge teams to do is to interview, as part of the discharge, ask some kind of basic questions about their state generally, but also specifically about the digital aspect of their care, and trying to get a sense of, so we can pick up their concerns, you know, with the kind of, you know, with maybe using apps or not, or whatever, or, you know, how they also access information about their appointments and all that kind of thing. Same with that radiology questionnaire. So I know it's an online questionnaire, but we've also tried to get people to fill it in paper, so we get a good mix of people. We're also asking one of the local charities to go around and actually interview, so people people from Somaliland, and others who we know don't speak English as a first language, as well, getting their views about obviously the care journey, but specifically also digital care. And there's a range of kind of different groups that we're targeting, but you know that those are the ones that those are the main ones that we've identified. Sorry, also carers as well. I know the digital team went to go and see one of the carers cafe meetings before Christmas. We're going to do some more as well with those. But yeah, so it's those kind of groups: carers, people who don't speak as a first language, people we know are kind of digitally less able, and then also people with learning learning disabilities as well. So, you know, there's a range of audiences we're in the process of speaking to and hearing from, and hopefully kind of squaring away and getting their feedback and hearing from them as to what, you know, what their concerns are with kind of digital care.
Thank you, David. I won't put you on the spot now, but it'd be great to have a follow-up conversation with you if it was okay, if you didn't mind me contacting you, because your counsel on how we do this I'd very much work with.
I was about to say that'd be great.
Yeah, I'd be delighted to do that. I've got very good contacts with most of the communities, not all of them, but you know, I'd be very happy to do that. Yes.
Huge thank you. If you don't mind, then we'll follow up with you tomorrow. Thank you.
Yeah. Okay.
Now, the marvelous thing is numbers now appear next to people, but they keep changing. So I'm just trying to. Is it Panthratan? Is that? Sorry, apologies if I pronounced it wrong. You've gone up to number 2 in the charts. Number 1 now. Are you there?
Thank you, Jason. Yeah. Thanks for the presentation, everyone. Just wanted to know what the specific provisions for mental health care and needs of patients who need to be in the hospital. What specific arrangements are being made for those?
So if you're okay, Vicky, I'll start, and then if you don't mind me handing over, I think if you look now about how and what hospitals do, certainly over the last certainly the last decade, mental health has to be absolutely integral to the way we provide the sort of front end of our hospital. So where Vicky was describing that emergency and urgent care floor, where before you so for us where there's other providers who sort of more specialize in mental health, there is going to be an absolutely key part of us when we're sort of opening the new hospital for that to be much more physically integrated in the new design. But I'll hand over to Vicky.
So clearly at the moment, the mental health services are provided by CMWL rather than Hillingdon, but we do have a number of patients who we keep in a place of safety in the trust, predominantly coming in through A&E before they can be found a bed for their mental health needs. Looking forward, going into the new build, as Jason just said, our emergency floor will have appropriate facilities for those patients, and much better than what we have at the moment, which are not frankly fit for purpose. And also our pediatric services will have suitable accommodation for those that can't be found a mental health bed in the time frame that they should be, so that we can look after them safely until we can transfer them across to suitable facilities. I just wanted to point out, as part of this, we also are planning a adolescent ward. So our pediatric facilities will not just be as they are at the moment, but we will have facilities that will be able to transition young people as they change from being children to being adults, and there'll be much better facilities for those as well, which will be able to support those with mental health needs who need a place of safety whilst waiting for a suitable bed elsewhere. Does that answer your question?
Thank you. Yes. Can I just come back with one comment? I won't hog the floor, just a comment. So I'm actually the mental health consultant for the hospital, and when this project was started, we were involved in some initial scoping work, but we found it very hard to get any engagement since then. Your answers are reassuring on one level, because you're right that the provision for emergency mental health presentation at the front door, should be improved, and hopefully they will be. I think the danger is you then assume that everyone on your wards has no mental health needs, and our day-to-day work is swamped with the wards with people with confusion, delirium, dementia, depression.
Absolutely.
And these are people who need to be on your estates. They've got medical needs primarily, but we find it very hard to offer them meaningful mental health care, sometimes to do with its surroundings, environment, that kind of thing. And,
Yeah.
and I hope we don't make it too binary, that either you're mental health and we just need to keep you safe and get you out, or you're not mentally unwell and then you'll be in our hospital, because unfortunately real life isn't that simple usually.
Well, I'm really sorry to hear that you've had difficulty engaging. Please come through to me, email me, and we can link in with the right people to make sure that we do get your input, which would be greatly received and really important.
Thank you. I'll drop you an email tomorrow, Victoria.
I'm Victoria Cook 3. Victoria.Cook 3.
Thank you, Vicky. Thank you, Pantherton. So we've got Donna's gone up to number 1 now. Are you there, Donna?
Hello, yes, I'm here. You hear me?
Hello. Yeah.
Right, my question is about car parking. In the last couple of years, I've acquired a blue badge through my illness. And when I went up to the hospital to park, I put my blue badge in the window. And then when I went to pay for it, I thought, I didn't realise you had to go to the security box to go and register your disabled badge, which to me, because I've got COPD, I parked in the main car park. I had to, and now because of COVID, all the corridors are all, one way. I would have had to walk all the way over to the guy just to show him. Are you going to change that? Because I couldn't do that. Lucky enough, the guy could see me on the camera and see that I was struggling, so he let me have my parking for nothing. Because I couldn't even walk to the car to go and get my badge to show him on the camera. So can we look at that in the future? What's going to happen about the blue badge parking?
Donna, if I could, Jason, if it's all right,
Yeah.
I'll take the question from Donna. Donna, first of all, I'm sorry to hear of your experience. Actually, I'll pick that up with my colleagues in the Estates Department, and hopefully they can address that. It's a really important point that you've raised. So thank you for that in the first instance. Secondly, yes, the new car park, the multi-storey car park, and the mobility hub is absolutely going to address that disability need. The need for parking for vehicles, cars, patient transport vehicles as well will be allowed to park in there as well. We have also made an additional allowance for, you might recall if you joined early enough, I mentioned there's a sort of ground floor car park just outside the front door, but between the green spaces. So again, additional provision for disabled car parking will be there as well. It will be a fully digitally enabled hospital, so hopefully you won't need to locate anyone specifically, and we'll have the provisions for you to be able to come and park with ease. That's what I can say. Yeah.
Because someone said to me, can you do it online? Register online. I looked and you couldn't. So the second time I came up, I had the same problem. I couldn't walk to security, so I just showed them my pass. So it does now. Thank you for that anyway.
Thank you, Donna. So if it's all right, T, I'll take that away and we'll catch up with you after the meeting, if that's okay. Right. Mary, you've gone up to number 1. You there, Mary?
Okay, thank you very much indeed. In actual fact, this is very exciting for me because I was a student nurse when we built the tower block. So I am around that long. But can I just, I'm about to whinge now. Can we please not call people bed blockers? They are delayed discharge for a very specific reason.
It's a fair point, Mary, and thank you for correcting us.
Thank you very much indeed, because especially when older people are in hospital, they do not want to be there, an awful lot of them, and they just want to be in their own homes. And when they are told that they're bed blockers, it is very derogatory to them. So I'd be grateful if people could just call them delayed discharge. And thank you for the presentation, absolutely wonderful. And this is a really exciting time for Hillingdon. And I'm in David Bruff's corner. Anything that needs to be done, please just let us know. Thank you.
Thank you very much for that, Mary. I probably would like to catch up with you if you could give me some of the lowdown on how it went first time round with the tower block. So I might follow you up on that of how it all went. Thank you. Right, Kay, you're number one now.
Thank you. Sorry for my appearance, but I tested positive for COVID this morning and I haven't got dressed all day, so I'm not looking great. Jason, one of the things that I wonder is, I haven't seen any time frame for the rebuild. I know a lot of it depends on plans and all this sort of thing, but at the moment with COVID, there's a dreadful shortage of building materials. And is the new hospital date still sort of, well, when we get there sort of thing, or do we have a time frame?
So it's a very good question in terms of how do you land sort of the agreed timeframes on building a new hospital. So the strategic. So if you're okay, I'll talk about the process and then what happens after the process. So in terms of that strategic sort of outline business case, and then full business case, the timetable we have is the recap. We've got our strategic outline case approved, so that's sort of the first piece. The outline business case, which we're sort of just in the process of finalising now, we are looking to get approved from sort of all the sort of big sort of names at the centre that you need to get a business case approved by. So we have NHS England and NHS Improvement. We have the Department of Health and Social Care. We are very much looking to get the outline business case approved with them over the summer. And then that full business case, which is that final stage, we are then looking to get that approved next sort of summer, so it's summer 2023. What that
We're
would
not going
then
to break ground for quite some time yet.
Well, what would that would lead to is the key piece of their main construction sort of commencing following that period, and what we'd look to sort of have which we've got at the moment, a sort of broad completion date between 2026 and 2028. Yeah,
Right.
your piece around, gosh, you're not in terms of breaking ground. I'll probably say this in two ways. For anybody who's attending the Hillingdon Hospital at the moment, apologies, because there is so much building works going on.
Mm-hmm.
But the fantastic piece of that is there is lots of what to hear referred to as the enabling and decamp work. So there is a huge amount going on already. So to hear, gosh, we're in 2021, 2022. In 2021, there's two big buildings that have gone up around the back that will be accommodating. One's open, the other one's going to shortly open soon. A lot of our clinical services, as we change the site round. Tahir's working through a number of parts of making sure that site on the left-hand side that he showed it will be ready. So it's hopefully to give you also some assurance, though, that a number of the sort of pre-works, which we refer to as enabling and decant, that work's happening now, which will mean that the site will be sort of really ready for the full works to start. I don't know if you want to add anything to here.
Yes, and just to reassure Kay, really, on the basis that we're not just sort of waiting for when we break ground. The techniques that we've now adopted in terms of modern methods of construction and off-site manufacturing, the process has started much sooner. So our supply chain engagement starts sooner as well. So the sourcing of materials is more carefully planned. We allow time in the program, in the system, to coordinate with the supply chain. Of course, yes, we're hearing there's a shortage of materials. Perhaps concrete with HS2 around the corner, but we are building a sustainably viable hospital, so our use of embedded carbon in concrete is less so a demand for our particular hospital. the materials are available. The prices are obviously questionable sometimes, but you know, but of course we are engaging with our supply chain to ensure that we're designing it, getting it ready, getting those components ready even before we break ground.
Right. Okay. Thank you.
Is that all right? Did we answer your question? You happy with
Yes,
that?
there was just one other quick question, if I can just take a liberty. One of the things, I'm a trust member, and I was on HIB with you, Jason. One of the things the hospital suffers badly with is we've got a dreadful lack of meeting rooms. I know a lot of meetings are taking place on Teams, which is, from my point of view, all right in the short term, but not ideal in the long term. Is this something that has been addressed with the new hospital, that, you know, we're going to have sufficient meeting rooms for what we need?
So on that one, I could give you a more binary answer of saying yes. So there's been a huge amount of work as part of the outline business case, sort of next stage of detail, to ensure, so around education and training, but certainly around sort of general meeting rooms and everything that comes with it, that we are very much incorporating that in the latest designs.
Jolly good. Jolly good. Thank you very much.
Thank you. Adrian, you've gone up to number 1.
Hi there, thanks very much. A couple of different comments. Things like the car parking, the actual car parking spaces to be adequate for cars, for people get in and out, and also when they're driving, leaving the car park, the view of it. That's one thing I'll bring up. Well, the second thing is for people who are autistic and also people who have eyesight loss, how friendly would the hospital be for that sort of thing?
Thank you, Adrian. If to hear you happy to take the call? Yeah.
Yeah, I could probably take part of the second question as well. So in terms of the car park, absolutely a consideration we've taken on board. I think, as Jason said earlier, it'll be a very binary yes. It will be a more functionally operable car park, which will allow good car parking facilities, not just for motor vehicles, as in standard family car, but larger vehicles as well. We're very mindful that people are traveling different SUV type vehicles, 4x4s, and of course the patient transport vehicles as well. So we've been engaging with car park providers, people who build these things across the country, for local authorities, for other hospitals as well. So we're taking on board their comments to ensure that the car parking spaces are adequate to allow people to come access the car park and obviously leave with ease as well. So that's in terms of the car parking facilities. In relation to the hospital itself, it's been designed in accordance with the Equalities Act. We are adopting a very equal approach to disabilities, things like partial sightedness, etc. So we will be confidently saying that the hospital will respond to that equalities agenda.
And things for people with autism as well, because noise, overcrowded areas, brightness, things along those lines affect people with autism. Again, like waiting areas for that, as well, so it's separated so people can keep sort of calm and not get wound up.
Yes, I won't go into specifics, but of course, yes, those have been considered. We're moving away from very large atrium, very large areas. We've created a number of waiting areas, as you've just suggested now as well, where people can find more appropriate waiting spaces closer to their area of treatment as well. So no, absolutely, we're not just building big open vast spaces that cause a multitude of difficulties for people with autism, for example.
Can I just come in quickly there to here as well to say that this is where the digital agenda helps. So rather than our current hospital where vast amounts of patients sit around in waiting rooms waiting for us doctors to call them into rooms, in the new hospital, the digital agenda will help. So it looks like when you go to a cafe and you get a buzzer for when your food's ready, there'll be all sorts of things like that happening. So people can go and wait somewhere else and then be called through when they're ready. And the designs very much for the architects are small waiting areas, and very much sort of making sure it's all not one big bright space, but much more personal and patient friendly.
And would there be areas for, like, so maybe if there's a person with autism, they don't like mixing with other people or things like that, where it's sort of like slightly sheltered away, like nooks and crannies in pubs, you have areas where it's a bit more private?
Well, certainly looking at the outpatient plans at the moment, there are nooks and crannies. It's working out how we best use those, and absolutely making sure that we make that space as appropriate for the staff and the patients that want to be using it.
Cool, that's great. And one other question as well for everyone is accommodation, or places where people got someone who's badly sick in the hospital, who live far away, like a change room or area, like a rest room where people can actually go and rest for a couple of hours in that, and have a shower and freshen up, that sort of thing. Would that be available in the hospital with these new designs?
I know that we're certainly planning the paediatric room so that there's adequate space for parents to be part of the child's care, and that the rooms will be big enough for space for child plus parent. I don't know of any plans for other patients, but I certainly do know that the patient space will be much bigger than it is at the moment. So the individual rooms will have a lot more space in, and we'll have ensuite bathrooms. So there'll be a much better patient space, and that hopefully will mean a more comfortable space for those that are visiting them as well.
So they can get changed and freshen up if necessary, if they live miles away. That sort of thing.
The absolute detail of that, I think, difficult to answer at the level of plans that we're at the moment, but obviously something we need to bear in mind.
Okay, cool. That's it. Thank you very much.
Now, apologies to Danielle. I was doing so well watching the hands that I could not multitask and did not realize there was a meeting chat box as well. So that's my fault. Danielle, so there's a question around car parking spaces, which I'll let, how many relative in terms of number of car parking spaces we've got currently, and how many car parking spaces we're planning in the new hospital. I'll leave to here to answer in a second. The piece around the pediatric A&E department and currently experiencing when it's been filled to the brim, and about in the new plans, is the pediatric A&E department bigger? Yes, absolutely. So there is a key piece, and I'm sure Vicky will add to it. But if you, when we've got to that next level of detail, you cannot compare in terms of some ways the space of our emergency and urgent care, both for adults and pediatrics, in terms of the current floor space, and what it's going to be in the new hospital will be a sort of a big step change. So the department will be significantly bigger. But I don't know if you wanted to add anything, Vicky.
Absolutely. So the current paediatric space is something that's built up over history, and is absolutely recognised to be too small, but is what we can manage in the current footprint of the hospital. The paediatricians have been very involved with the plans for the paediatric A&E space, and absolutely. I can't remember to hear how many football pitches the size of the emergency unit is. It's several times the size of Wembley, but I can't remember the exact. My instinct is 3, but I might have it wrong.
I prefer cricket myself, Victoria, but I think you're right. It's a very generous space down on the ground floor there. Just in terms of that car park one, Jason, very quickly, just to say that the numbers will be proportionate to what we have at the moment. We're not planning reduction in car parking, but we are going to be complementing that to encourage people to take up some of the other forms of sustainable modes of transport that we will be encouraging as part of our new hospital design as well. So we do need to think more about the environment and the sustainability agendas. So we're hoping to see a reduction in car parking, but for the moment it is equal to what we have at the moment.
Thank you, Vicky. Thank you, Tahir. Conscious that we've now sort of run out of time. If it was okay if we took a final question from Anna, but then hopefully in terms of roadshows, we'll have another one of these meetings, I'm sure shortly, that we can continue the discussion. So Anna, are you there?
Yes, I am. Thank you for your presentation. I just wanted to ask, given the aging of the population, I was wondering if you have or are you planning to have a geriatric ward in the new hospital?
Vicky, you all right answering there?
So absolutely, we currently have care of the elderly wards. We currently have a frailty unit, and it's very much been planned in the new build that we will have the right emergency on the emergency floor. We will have frailty units. We'll have the rapid turnaround unit that patients can be seen, assessed and discharged home as safely, and then those patients that need to be admitted will be admitted to the wards. And as I said at the beginning, the bed base will be slightly more than it is at the moment, and those wards will include care of the elderly wards with all the appropriate facilities, and much better facilities than we have at the moment. Lots of single rooms, lots of good monitoring, so state-of-the-art digital, which means we'll be able to monitor our patients and for falls, as well as the all the normal observations that happen at the moment. So really fit for purpose facilities.
Thank you, Vicky.
Wonderful, thank you.
Thank you, Anna. So conscious of time, Tony, are you wanting to make, and conscious you're on sort of the next one, is there any closing statement you would like to say, or is this another question?
If I could, I'd like to pick up the point that David was talking about early on, excuse me, about the lack of ability to connect digitally. I think that's something we've got to work across the whole borough. I'm conscious of the fact that many residents in Northwood are unable to communicate with their GPs because they cannot communicate digitally. And I think we've got to set up a help system borough-wide so that people who are not able to communicate digitally can be picked up and assisted.
Thank you, Tony. Certainly something to take away. Roger, is it a very quick one at the end?
Yes, if I may. Thank you, Jason. I'm thinking about Mount Vernon Hospital Treatment Centre.
Is it?
Are they going to be brought up? And the other aspects about open space of the new hospital. Very pleased to see it's going to be a wetland area.
Sorry, Roger, I'm having problems.
Yeah,
hearing
I think
you.
we're all struggling. I certainly am in the same boat.
Can you hear me?
No. Is it okay if I contact you tomorrow?
Yeah,
Is
I'll
that...
tell you what, I'll send you an email, Jason.
If you don't mind, and I'll follow up tomorrow.
Okay, that's great. Thank you.
Thank you. Hopefully you can hear me. Thank you. So that was the end of our first roadshow. I'm sure. When's the next one, Neil?
I've just put it in the chat. It's 3rd of February, same time.
Yeah.
And then there's another one on the 17th. All the details are on our various channels, Facebook, social, and indeed, if you go into the hospital as well, there's details of various posters and stuff. So if you want to come to another one or you want to got more questions, then please do come.
Thank you for that. A huge thank you to Tahir and Vicky as our respective estates and clinical leads. I mean, just is, if you look at their knowledge, the amount they're on top of at the moment in taking forward the agenda is huge, but doing an absolutely amazing job. So huge thank you to both of them. Neil for organising it all, and again for all of you who have joined. What was the maximum number, Neil?
We got to about 26.
26.
We got
So
50 booked on, but
a big thank you to everybody for joining us, because I know taking up people's time on things like this. So thank you, and hopefully look forward to seeing everybody again 3rd of February. Have a great evening. Thank you very much, everybody.